As you adjust to using and maintaining your child's tracheostomy, you'll find that it gets easier to do. Most of the time, things will go smoothly. However, challenges and even emergencies related to the trach can happen, and it is important you are prepared to manage these rare, but sometimes life-threatening situations. While we can't go over every possible emergency scenario, the purpose of this video is to show you how to support your child if they are not able to breathe through their tracheostomy tube. While in the hospital and providing care, you will learn the difference between normal and abnormal breathing. If you notice your child has stopped breathing, this is an emergency. You must call 911 immediately. After calling 911, check that the trach is in the stoma and the ties are secure. Attempt to breathe for your child with the ambu bag attached to the trach. If you feel resistance, suction. After suctioning, try to give a few breaths with the ambu bag. You should see the chest rise and fall. If you feel resistance after suctioning, change the trach, as it could be plugged with mucus. If you are still unable to move air with the bag after changing the trach, provide breathing with the bag and mask through the mouth and nose while covering the trach to prevent air escaping. If still unable to move air, the next step is to remove the trach and provide mask breathing through the stoma. When doing a trach change, or if the trach comes out accidentally, it may not go back in. If you cannot reinsert the child's normal size trach, attempt to insert the smaller backup trach. If you are not able to insert the smaller trach, call 911. Put the phone on speaker so you can continue helping your child. You want to ensure that breathing continues even if you cannot replace the trach. If your child can move air through their nose and mouth, use the ambu bag, fitting the mask over the nose and mouth. You will need to cover the trach to prevent air escaping through the neck in order to deliver breaths. If your child cannot move air through their nose and mouth, place the mask over the stoma and deliver air directly through the stoma. If the ambu bag is not available, give rescue breaths through the stoma. If your child is unable to get air with any of these methods, start CPR and continue until emergency services arrive. Please be assured that you will spend time working with your child's care team to understand the different types of emergencies that can happen in children with tracheostomies. It is important that you understand your child's airway anatomy. Learn how to use the ambu bag on both your child's mouth and nose and on the stoma, and know when to call for help.